Meghalaya State AIDS Control Society can prolong Red Fest, the Northeast Multimedia Campaign, Halarti Center for Performing Arts, Kabadan Hamau Tiang Tiang, Haka Arpu Pratrik Rumpang, Araja Arpu South. Haba Jinkren, Nakalang Director but Officer Jong Meghalaya State AIDS Control Society, Kilapentip, Bahagani Red Fest can say one by the Chimbata, the Palat, Araja Sanspangut, Kuntup Ki He, Sorka, Nagitnat. Trekam ki prepare nagathan chite lamingi bakin one ru ki he Jong National AIDS Control Society. La pentip baka Red Fest kin sadon ki nongrai but ki Kynhun tem na borok ki district Jong Than chite lamingi ki bakin thup ik somersault toxic poni ni po Meghalaya Umoko koza na po Nagaland Girish but Chronicles na Sikkim Voodoo Child na Assam but kiwe dam. Kilawang makathong kajong ki hi kalong ban ai jing kai bat jing tip phang ki wei kumno ban te la kam ya jing pang HIV AIDS bat leng ba ka program ki sadon ru ya ki screening nagam ta ki bakwa ban cha test bat ki wei de ki jing pin bernya.
We are from the Office of Meghalaya AIDS Control Society. I'm Dr. Beth De Cruz. I'm the Project Director of Meghalaya AIDS Control Society. And with me is Shri Jylla. He's the Deputy Director looking after mainstreaming. Deputy Director Wilson Dolling, he's looking after the prevention unit. Then Assistant Director for greater involvement with people living with HIV, we call the JIPA, is Sion Marway. Then also we have Larina, she's also Assistant Director looking after youth. And Rap, he is looking after the IEC. And also Daffy, she is looking after documentation and publication. So the main purpose of us calling this press conference is to brief on this. We'll have this Red Fest on the 28th of this month, in February. The venue will be at Larity Performing Center, and the time will start from, the registration will start from 10 a.m. onwards. So this is called the Red Fest. It's the 5th Northeast Multimedia Campaign, and to brief more on this, I will hand over to Jylla, the Deputy Director looking after mainstreaming. Thank you.
Thank you so much, ma'am. So the main objective actually of having this multimedia campaign is actually to create more awareness on HIV AIDS. So altogether, like all the 88 northeastern states will be gathering like tomorrow at Larity, and each state will be bringing their own respective bands, popular bands like to come and perform. So why, as we all know, because music is the easiest language anybody can understand. So by doing so, by having this musical event, we plan to do so much more with that platform. Also, the objective of this MNC is actually to enhance the risk perception and promote safe sex behavior. Also to issues, especially stigma and discrimination surrounding, especially for people living with HIV. Also to motivate different population groups to seek services such as integrated counseling testing centers, sexually transmitted infection centers, Raksha clinics as we call them, PPTCT, ERT, etc. And also for the normalization of condoms. And when we talk about condoms, it's the safest way to prevent HIV. So, like ma'am had said, this will cater actually to the youth between the age group of 15 to 29 years. And also, the campaign will reach out to 126 districts all over the Northeast, combining all the Northeastern states in the Northeast. So like ma'am had said, we've actually given you all a press kit, so all the band information is readily available for you all there, as well as the concept note on the Red Fest. So if you have any questions at this moment.
So we'll address the HIV scenario of Meghalaya first. Okay. So the HIV scenario in Meghalaya is above the national average. We stand at 0.42% the adult prevalence rate, which is higher than the national average, which stands at 0.21%. So that other northeastern states also are higher than the national average. And the district, the main district that are facing more problem on the HIV here are the East Jaintia Hills and the West Jaintia Hills. Also now we are starting increasing cases in East Khasi Hills and Kynhun district, and also even in West Khasi Hills district. Yes, we do a lot of awareness campaign, but we have just finished in East Jaintia Hills. We had conducted this what we call the integrated health campaign. In that campaign, we target both the awareness and also screening and testing. We go to all the villages. We cover 202 villages of East Jaintia Hills. We have these what we call the static camps. In the static camps, we integrate together with other health programs like the TB program, the viral hepatitis, and for non-communicable disease, and even for eye screening, dental screening, and because we coordinate together with the district administration, so we also do the Aadhaar enrollment and the energized enrollment. In that campaign, it's very successful, whereby like a lot of people, we are drawn to these static camp, and then some of the high-risk group are not coming to these static camps, so we go with these what we call the extended outreach, where we target only for the high-risk group. So we go to this hotspot area and in the workplace also. So that we covered in around 104 extended outreach. Yes, we do a lot of awareness campaign, like what we have just finished in East Jaintia Hills. We had conducted this what we call the integrated health campaign. In that campaign, we target both the awareness and also screening and testing. We go to all the villages. We cover 202 villages of East Jaintia Hills. We have these what we call the static camps. In the static camps, we integrate together with other health programs like the TB program, the viral hepatitis, and for non-communicable disease, and even for eye screening, dental screening, and because we coordinate together with the district administration, so we also do the Aadhaar enrollment and the energized enrollment. In that campaign, it's very successful, whereby like a lot of people, we are drawn to these static camp, and then some of the high-risk group are not coming to these static camps, so we go with these what we call the extended outreach, where we target only for the high-risk group. So we go to this hotspot area and in the workplace also. So that we covered in around 104 extended outreach. The health department, this is multifactorial factors. There are so many factors, social factors, the economic factors, as well as the health factors. So what we have done from the health department, we have addressed this issue, and it is a call for other department also, and also for the press to come forward and spread more awareness on this. If we don't do it together, we will not be able to reach more in West Jaintia. But when we look on the prevalence, it's more in East Jaintia, because like the number of people, looking at the population. The main cause, like routes of transmission, is sexual routes. Okay? In the Jaintia Hills, and even in other parts of Meghalaya, it's mostly from sexual routes. And if we look at the rural area, if we analyze more in the rural area, it's more to sexual routes. But if we look at the urban area, it's more through the injecting routes.
Prevalence is 1.34%. Manipur, the prevalence is at 0.94, and Meghalaya 0.42. So these are the four northern states with the highest prevalence comparatively with the other north.